The esophageal feeder can be a useful on-farm tool to administer colostrum or an electrolyte solution to calves. Understanding the proper technique is critical to success, as esophageal feeders can cause damage if used improperly. Esophageal feeders come in a variety of sizes, ranging from those used with calves to adult cows. The feeder consists of two main parts: a stainless steel or plastic ball probe with an attaching plastic bottle, which holds the fluid to be administered. The amount of fluid the bottle or tube can hold ranges from 2.5 quarts to 1 gallon. The stainless steel probe can look intimidating, but it is less likely to twist or kink compared to a plastic probe. The length of the tube and size of the calf will dictate how far to insert the tube. You can approximate this measurement by placing the probe and tube on the outside of the calf. Measure from the mouth of the calf to the point of the shoulder, as this will approximate the distance from the mouth to the rumen. You can mark this measurement on the tube. Prior to passing the tube, inspect the tube for any cracks or rough edges. If any are noticed, discard and replace, as the rough edges may cause abrasions along the esophagus, leading to a sore throat. The cracks and scored edges may also harbor large amounts of bacteria, potentially leading to disease in the newborn calves. Replacement of esophageal feeders should be a regularly scheduled task. The calf's position is very important for the usage of the esophageal feeder. If the calf cannot maintain a sitting position or its abdomen is already full, do not use the feeder. It is easier to accidentally place fluid in the lungs of the calf that is lying flat, causing aspiration pneumonia or fatally drowning it. Having the calf in a standing position is preferred when delivering fluids. Properly restrain the calf by backing it into a corner or holding it against a wall or fence. Straddle the calf with the head between your legs. If the calf is not able to stand, it should be able to sit up on its sternum with the head between your legs prior to passing the tube. Clamp or kink the tube if using a bag type model. If using a bottle type model, remove the rigid portion of the feeder to ensure no fluids run into the mouth to potentially be inhaled into the lungs. Lubricate the end of the tube with the liquid you are feeding the calf. Apply pressure to the gums of the calf with your fingers to stimulate the opening of the mouth. While keeping the calf's nose lower than its ears, insert the tube along the tongue on the left side of the mouth, as this will cause the calf to swallow. Wait patiently. Once the calf swallows, pass the tube down the esophagus with the calf's nose below its ears. Note the mark you made on the tube, being sure not to pass the tube past this point. When positioned correctly, you will feel two distinct tube-like structures in the neck: the tube feeder and the trachea. The tube feeder will be in the esophagus along the left side of the calf's neck. The trachea or windpipe will also feel firm with rings or ridges. An additional way to know if you pass the tube correctly is to move the tube back and forth to identify the esophagus with the tube feeder. If you are unable to feel the back and forth movement of the tube, or you feel spurts of air at the exposed end of the tube, you have inserted the tube into the trachea. Remove the tube slowly and try again. Once you know for certain that you have passed the tube properly, attach the bag or release the clamp and begin dispensing the fluid. Raise the bag above the level of the calf to administer the fluid by gravity while keeping the calf's nose below its ears. The calf may move when it feels the pressure of the fluid filling the rumen. Do not remove the tube until all the fluid has had enough time to reach the rumen. Clamp or kink the tube end or remove the bottle prior to pulling the tube out. It is best to remove the tube in one swift, gentle motion while holding the calf as still as possible. Clean and disinfect the esophageal feeder properly after using. Because of the fat content in the colostrum, it is important to use mechanical cleaning with a brush. Wash water should be greater than 145 degrees Fahrenheit. Rinse using cool 90 degree Fahrenheit water. Soak in hot water greater than 130 degrees Fahrenheit with 1% chlorinated alkaline detergent. Dry by letting the equipment drain completely before reuse to prevent the growth of bacteria. Consider the probe a single service item, cleaning and sanitizing between calves if possible. Have separate feeders for colostrum and electrolyte solution with enough feeders so that they can be cleaned, sanitized, and dried prior to reuse. We would like to thank the calves of North Central Technical College and their previous veterinarian, Dr. Luke Peterson, for helping to make this video possible.